We're good to go? We good to go?
Yep.
Okay. Hey, everyone. This is Dr. Clay Williams with University of Texas Health East Texas Medical Center here in Tyler, Texas. I want to welcome all of you to the webinar. Thank you for taking the time to watch this, whether it's live or those of you who missed it or didn't know about it, you can watch it recorded. We're going to talk about basically erectile dysfunction. What the causes are. A lot of you know, a lot of you don't know. You're trying to figure out why this is happening to you. We're going to go over the causes. We're going to go over different treatment options, and then ultimately we're going to get around to talking about the implantation of a penile prosthetic, the Coloplast Titan cylinders. And I would ask that if you have any questions whatsoever, type those in, and I will be more than happy to try to fill those questions and answer those questions the best I can at the end. So if you see that I'm not, addressing those questions during the presentation, just hold back. I'm going to get to you. Okay. So here we go. Erectile dysfunction with different treatment options. Basically, I got involved with men's health in residency for urology. Urology is a very interesting field, probably more than any other surgical specialty. We have just an enormous amount of surgical procedures that we do, and we learn all of them. But the one niche that I really found, kind of dear to my heart was male sexual medicine, andrology, whatever you want to call it, and just kind of gravitated to that area for my practice. And I've been in Tyler, Texas for 20 years now, or almost 20 years this summer, and I do male and female sexual medicine. And so hope you enjoy this presentation. So real quickly, we're going to go over erectile dysfunction, the causes, what it basically is, the psychological effects. We'll go for different treatment options and go from there. Now, erectile dysfunction is a very difficult situation. There's a lot of psychological impact. A study was done many, many years ago when there's a question whether or not some of this stuff could be paid for by insurance and Medicare, namely penile implants, and they showed that the psychological effects of erectile dysfunction were pretty catastrophic. So luckily we have insurance on our side and Medicare on our side. But because erectile dysfunction is real, you have it. We see it sometimes very early in life, in 20s, 30s, 40s for sure. And it's a real anxiety-provoking part of your life. We want you to be able to know the causes and see what you can do to kind of take back hold of your life and get your confidence back. And rest assured, guys, man, you're not alone. You see the slide deck, 50 million men in the United States has some degree of erectile dysfunction. And I love the 40-40 rule, 40% of men at 40 years old. Now, when I was in residency, I don't think we had numbers quite that high. I think it is becoming more prevalent. I also think that men are more likely to talk about it. And I praise you guys for doing that. You're bringing it up on golf courses, at men's meeting. I don't know if you bring it up at church, at Sunday school or not, but you're more likely to bring it up to your buddies, borrow some Viagra, borrow some Cialis. We'll go over those medications in a second. So the disease is becoming more prevalent because of the way we live our lives in different disease processes, but we're also more apt to talk about it. So I praise you guys for bringing it up and bringing it up to your primary care physician and getting referral to a board certified urologist like myself. So I mentioned about the psychological effects. Half the men, if they really are asked about this and they want to be honest and truthful about it, you'll see that 50% of patients says that ED affects their life, and that's 1 out of every 2 men, honestly saying that ED was an issue. Almost 90% say that it lowered their confidence. It also, and this is really important, half the men say that it really became an issue with their girlfriend or their boyfriend or their wife, whatever is going on. And that's a real big deal too. So it's not just you, but as a man, you're feeling that it actually is affecting your partner, which only provides more anxiety and potential depression with this. About 70% of men say that it affects their intimacy, so that their sexual interplay with their significant other. 70% of men say that this is really a big issue on how they feel intimate and close to their loved one. So what is erectile dysfunction? Well, we probably going to answer that a lot of different ways, right? But essentially, the simplest answer is it's just the inability to sustain an erection or maintain an erection that's adequate for sexual intercourse or sexual interplay. And again, it could be because you cannot get erection, you cannot maintain it. And a lot of you guys, you say, hey man, I'm watching this and I have both. I have both of the problems, and that's quite common as well. So the question I get sometimes in my office, among others, is this just because I'm getting older? Well, yeah, sometimes, but it doesn't have to be that part. We see ED or impotence in a lot of young men. I opened up saying this, we see this sometime in 20-year-olds, but definitely 30 and 40. Remember the 40-40 rule, 40% have ED of some degree at 40 years old. That doesn't mean that you can't get an erection at all, but it might mean you're beginning to see that your penis is not as robust. It's not quite as erect, or it's taking you longer to get an erection. So there's different degrees. It's not always an all or one or all or none type situation. So what are the causes? And I get that in my clinic all the time. Hey doc, I didn't have this problem 5-10 years ago. What's going on? Well, before I even walk in the room, I'm going to look at your medical history. I'm going to look at the chart. I'm going to look at your diseases. I'm going to look at your medications. And as you can see here on the screen, diabetes, high blood pressure, cardiovascular disease, anything that affects the nerves and or blood vessels throughout your body can affect the small nerves and blood vessels of the penis as well. So the penis is not a protected organ. Sometimes smoking, drug abuse, drinking too much alcohol can also cause it. To make things worse, some of the medications that you take, some of your statins like Lipitor, your beta blockers for high blood pressure like metoprolol, atenolol, they can contribute as well. Now, as a urologist, I am not going to tell you or try to stop you from taking the medications that your primary care provider has given to you. I'm just saying, when you start talking about this, you may come in with ED, and I may tell you, look, you've got 1, 2, 3, 4, 5, or 6 risk factors or diseases or medications that are all contributing to this. And then obviously a spinal cord injury, or maybe you've had a radical prostatectomy for prostate cancer, that can also cause ED. So how does the process really happen? Like, how do you really get an erection? Well, there has to be kind of a neurochemical, hormonal situation where everything is kind of in this witch's brew that's going on at one time. So you have to have the libido, the bravado, the sexual desire, and then you have to have these hormones and this neurochemistry going on in order to get the erection. And essentially what happens is, for lack of better description, the nerves to the penis will release a chemical or a neurotransmitter type situation whereby it causes the blood vessels into the penis to dilate. They open up, which allows blood flow to go into the penis. And once it does that, as you can see on the screen, all the little lacuna, all the little spongy tissue, all the little nooks and crannies inside the erectile tissue or the erectile bodies called the corpora cavernosa become engorged with blood. And when that happens, all those fill it with blood, and that's how you get the length and girth of an erection. But if you have one of these problems with obtaining, maintaining, or both, there's a lot of solutions, luckily for you. Now, you can do an oral medication, Viagra, Cialis, Levitra, the medications. We can teach you how to do a penile injection therapy. And guys, you may look at that and say, man, that's not for me. Needles in the penis. But you'd be surprised what guys will do in order to get this back in their love life. And as a urologist, I prescribe an enormous amount of penile injection therapy. You can use a vacuum erect device. Many of you are watching this. You're well versed and you know about this. You probably own one. You can do a urethral pellet or a gel that you insert into the urinary tract at the end of the penis. And then we're going to get around to penile implants here shortly. So obviously, most of you are going to start with some sort of oral medication, Viagra, Cialis, whatnot, and those really did change the practice of urology when those medications came out a number of years ago. But we do find that the medications either don't work adequately or they do for a time and then they begin to wear off. I mean, half the patients will discontinue one of these medications or multiple medications just within the first year because of it doesn't work. It can be very costly, and there are potentially some side effects such as muscle aches, flushing of the face, you get hot, headaches, an upset stomach. I've seen people get pain in their testicles, joints, and muscles. Doesn't mean you will, but sometimes the trade-off of getting a good erection is not worth the side effects. Again, there's multiple medications on the market. Each one essentially works the same way. The side effects are listed. I neglected to say the nasal congestion. The only downside of the medications is even if they work, you kind of have to plan ahead, right? You have to take the medication, let it digest for about 30 to 40 minutes. And if nothing happens, well, you just kind of wasted that pill. And that's some money down the tube. So you kind of have to plan ahead to use these medications. And like I said, 30 to 40% of the time, they don't even work to begin with. If a medication fails, then we do have penile injection therapy. Please, guys, again, don't say no to this. It's a good therapy, but it does require that you have to inject the penis with a needle each and every time. So instead of taking Viagra or Cialis, you would basically pull up in a syringe, pull the medication up in the syringe, and then take your penis and inject with a needle. It can hurt sometimes. It can cause some bruising. Sometimes it can cause an erection longer than it should. Now, it may sound great that you have an erection and you can have sex for like 1 or 2 hours, but trust me, that's not good because that blood can get congealed. It can become deoxygenated blood, and you start getting poor blood flow, and it's called priapism. And that can become very dangerous if not corrected quickly. You may never have an erection again, or you'll have some difficulty, even more so with erections. But it's still a good therapy as long as you're educated correctly. But again, you have to inject it about 15 to 20 minutes before sexual interplay. So very similar to taking one of the oral medications. Again, side effects, we talked about priapism, penile pain, numbness, irritation. You can start getting some plaques or firmness on the penis. If you're not careful, that can start causing curvature, which is called Peyronie's disease. I'm sure you've seen all over TV on the internet as well. The vacuum erect device obviously is not a medication, and you don't necessarily have to do it, 20 minutes or 15 minutes before sexual interplay. But now you have this very cumbersome cylinder that you have to place your penis into, and then either with a hand-activated pump or battery powered, where you press a button, it creates a vacuum and pulls blood into the penis. And oftentimes you have to pull a little silicone ring that you preload on the end of the pump. And before you turn the vacuum off and take the pump off, you pull the ring and it clamps around the base of the penis. And that helps to hold the blood flow in if you're one of those guys that has a difficulty in maintaining the erection. However, with that very tight ring trying to keep the blood in there, you can imagine that it's going to start causing some sensation loss. The penis will start getting kind of cool and cold to the touch. And so, after X amount of time, 5, 7, 8 minutes, I don't know, it starts becoming very painful. It can pinch pubic hair. So the satisfaction rate on vacuum erect devices is interestingly fairly well, but it's almost like 0 to 100%. Either it works very well, you're happy with it, or it's just too cumbersome. You don't want to take it on a vacation, on some trip. And so, again, if it works well for you and your sexual partner, that's awesome. That's great. But there are some side effects, to it. The intraurethral pellets or gel, that really was kind of the mainstay of erections, along with the vacuum erect device, injection therapy, and obviously before Viagra and Cialis and Levitra came out. And so this is very popular. I've probably prescribed this 2 or 3 times in 20 years. I mean, honestly, with all the other options out there, we just don't do this. But it's still an option. Erections can happen within 10 minutes, sometimes a little bit, quicker than Viagra and Cialis because you're bypassing the gastrointestinal system. You don't have to digest it. So it may have a quicker onset, but a lot of patients complain that it causes a lot of what we call dysuria. They have a lot of stinging and burning in the penis when they urinate, and even if they don't urinate, just the gel and the pellet itself can be very irritating. So we don't use this very often, but it is obviously an option for you. And this gets us around to, what I love the most about male sexual medicine and pelvic floor reconstruction is the implantation of a 3-piece penile prosthesis. There's not I guess, a rule or an algorithm as far as like a stepwise ladder that states that you have to have tried and failed every single thing that I have mentioned. Now, obviously, we're not going to surgical implantation day one when you come see me. We're not going there. We're going to talk about Viagra, Cialis, vacuum erect device. But a lot of you have been through these other treatment methods. I had a patient today, or this morning, who came to see me, and he literally was coming in to get scheduled for a penile prosthetic implantation because he had tried Viagra. It caused headaches. It worked decently, but it had a lot of side effects. He tried Cialis. It didn't work at all. Vacuum erect device, he found to be cumbersome. His wife didn't like it, and he was not interested in injecting his penis with medication. So my job is not to force him to do that. We started talking about surgical implantation. So you don't have to exhaust everything, but bear in mind, we're not going to, move straight into surgery the first time we see each other. Now, the beauty about a penile prosthesis is it's very discreet. You can't see all this. So I know you're looking at the graphic with the man right there, but this is all internal. You can't see this. The reservoir balloon that holds the fluid, the pump that goes in your scrotum between your testicles, and the 2 cylinders that go into the erectile tissue, which is no longer filling it with blood. This is all self-contained. It looks very natural. You could, after a workout or something, or you're in the shower or steam room, whatever it is, and you should have a towel on, but let's say you're not, or you're at the urinal, someone glances over, whatever it is. I mean, bottom line is you cannot see this. It's completely self-contained. And the beauty is you can inflate and deflate it whenever you want to. There's none of this lag period of 20 to 30 minutes of taking medication or inject yourself, or, I'm sorry, hold on. Let me go to my nightstand drawer and get my, my vacuum erect cylinder out. It's very spontaneous. You just basically squeeze the bulb that's in the scrotal sac, and that transfers fluid from the balloon into the cylinders and gives you an erection. So it's very spontaneous, and you have control of it, and so can your partner. So during foreplay, it's easily to move this into your foreplay. You may not want your partner to actually inject your penis with a needle or put a vacuum pump on you, but during sexual interplay and as you're touching each other very sexually and very romantically, it's very easy to see how your partner could easily help you inflate the prosthesis as well. So there's so many nuances of this that makes it much more exciting, in my opinion, than some of the other options that we have reviewed. And a lot of people say, well, how long does this penile prosthesis, last? Surprisingly, about 75% or more of these are working perfect, very well, 10 years or even more. So the longevity is excellent. Whereas on Viagra and Cialis, you might find the medication work very quickly. So here's a quick video about the inflation deflation of the penile prosthesis. So you see where the arrow is pointing to the reservoir, which goes down deep into your pelvis. The 2 cylinders go into the penis, which are the erectile tissue that normally should fill it with blood, and the pump goes down the middle. And simply, this gentleman is locating the bulb, and he's squeezing through the scrotal skin, and by doing so, he's transferring the fluid from the reservoir into the cylinders. And you see, he's not doing anything. It stays erect. And then when he wants to deflate it, there's a release mechanism, two little bars at the top above the bulb that he is squeezing at the same time he squeezes the penis and deflates it. And if he wanted to, right then, he could have reinflated it. I mean, you could inflate, deflate all day long. It's not the same thing as we talked about a while ago about a prolonged erection, say with the injection therapy of the penis called priapism. If you left this penile prosthesis inflated for hours upon hours, it would become uncomfortable. But it's not a surgical emergency because we're not talking about blood flow going through the penis and causing all the pain. This is different. So you can inflate and deflate this penile prosthesis and leave it up for quite some time, unlike with the injection therapy. One of the most important things I think you need to take home from this is looking at the satisfaction rates. This, to me, is one of the biggest take-home messages of the webinar, and I really want you to think about this because this speaks for itself. You've got a 98% satisfaction rate of men who've had a penile prosthesis. Now, I don't know the orthopedic literature about getting a total knee or a shoulder done. I'm sure in some sort of orthopedic literature, you know, the inability to walk comfortably or to move your shoulders, I'm sure there's some high satisfaction rates after surgery as well. But I would say most of the things we do in surgery and medicine, I'm not sure everything has a 98% satisfaction rate. And what I find even more exciting is that when you ask the significant other, the satisfaction rate is essentially the same. And I think that speaks well because as a man, we want to have erection and we are inflating the penile prosthesis and we feel more confident. We're getting an erection. We feel more like a man again. Even if we don't have sexual interplay for months on end, just the ability to have erection, there's something about that psychological, as we talked about at the beginning of this webinar, that really, that at least we know we can get erection. But to know that your sexual partner is also satisfied, which means this doesn't feel abnormal to him or her. The satisfaction rate would be a lot lower if it was weird and cumbersome. But the fact that it's so high means that your sexual partner is intimately involved with this and very happy with the device. And I think that might be more important than almost anything else on this slide deck. So why choose the Coloplast penile prosthesis using the Titan cylinders? Well, number one, when you compare it to the competing company, the Boston Scientific AMS 700, the hydrostatic pressure, you know, the how robust, how strong the cylinders are, you'll see that it's at least 3 times more rigid. Now, as a man, if I'm going to get an erection, I'm going to go for the one that's 3 times more rigid, more robust. It just makes more sense. You also statistically get about 17% more girth with the Titan Coloplast implant than you will find with the competitor, the Boston Scientific AMS 700 implant. And you also find the Magic 3 again, it's 3 times more durable than the competitor. And so I think this is going to give you more confidence, especially with different sexual positions, because certain positions are going to require a little more finesse and might require, you know, an erection that's a little bit firmer, a little bit more rigid, a little more robust. And so I love this slide because we can talk about, you know, your satisfaction rate, but on the last slide we talked about the patient satisfaction rate. But I think going through the intricacies about this of like, okay, why is it so much better? Why is the satisfaction so much higher than the competitor? Is because of the 3 reasons listed here. And part of it is because the material for the Titan cylinders is using what they call a BioFlex material. It's very safe for the body. It's stronger than silicone. You're not going to reject it. There's no allergy to it or anything like that. And so I actually got that question last week about some sort of, you know, can you reject this? Is it silicone? And I was like, wow, this guy really is really thinking outside the box, trying to compare us to silicone. It's not silicone. It's a wonderful material, and it's very easy as a surgeon to implant the cylinders because it's very slick on the outside when we implant it. And so it makes my surgery go a lot quicker than when I try to implant the competition three-piece prosthesis. I personally like the Genesis pump. Oh, this is the Malibu implant. I'm sorry. So there are those who have really poor diabetes. Maybe you have Dupuytren's contractures, you have carpal tunnel. There's a number of reasons. And trying to pump the little bulb inside the scrotum is just a little difficult. And if I suspect that in a client that I'm seeing in preparation for a surgical implant, I will have them squeeze my thumb as hard as they can. And if I feel like this is not going to be a good option, or maybe they're right-handed and they have some issues here, and so they have to use their left hand and it's just weak, then I think the malleable penile prosthesis shown here, the Genesis, is an option. And basically, again, it's concealed, but there's no reservoir, there's no fluid. You essentially, when we put the two rods in, you bend the penis down and up when you want erection. It's that simple. I personally don't place this very often because most of the men I see have very strong hands. Maybe that's just a Texas thing. I don't know. But this is a great option for you. So if you're watching this and you say, well, I just don't know if I can, squeeze that bulb, this could be an option for you as well. So don't give up hope. As far as risk, it's pretty low. The number one risk of any surgery that any surgeon does on any person is going to be infection, right? That's the one thing we worry about. And so we do our due diligence, checking urine cultures, getting a good history about any potential risk. And we cover you with antibiotics, after the surgery, during the surgery. The other risk is, will this malfunction at some time? But you saw the slide a while ago that said 75% satisfaction. I mean, 75% were still working well at 10 years. So eventually, even if you have orthopedic surgery and you have a total knee or total hip, they're not going to last lifelong either. Sometimes you can get maybe a defect in the penile prosthesis. It's usually in the pump, but again, the longevity is 75% or more. We always worry about incorrect sizing. As long as you look for a board certified urologist who has a high volume implant, they're not doing, 10 a year. They're not doing one a month. I mean, think about it. If you went to see an orthopedic surgeon and he or she said, yeah, I did a total hip last month, you would run away. It's the same thing with penile implantation of a surgical prosthesis. You want someone who does a fairly high volume. And one of the reasons is because you don't want them to incorrectly place the prosthesis as far as length, whether it be too long or, God forbid, too short. Insurance, luckily, because of something I said earlier, and I remember being at a seminar many, many years ago when there was question whether or not insurance and Medicare was going to continue to agree to pay for penile implants. And luckily, they showed data, very clear data, that the psychological profile using, the psychiatric questionnaires showed that the anxiety and depression from ED was really high, and we were able to get these paid for. So most insurance coverage and Medicare do cover this. It's something, if you come to the office, we'll always send you to the financial advisor if there's any questions. You may have a copay, just like any other situation, but you'll find the vast majority, if not really all, insurance plans will cover the procedure. But again, we have people in my office, and I'm sure most urologists do too, with advisors that can go through your insurance plan and tell you whether or not this is completely covered, but it should be. If you look at cost comparison of different treatment options, the annual cost of sildenafil roughly is $768. The average cost of penile injection therapy, you're getting around close to $9,000. And if you look at a penile prosthesis, $4,400. And that might amaze you. That's because insurance companies do such a great job of covering the surgical procedure. So there are a lot of different avenues. as far as trying to get some counseling, you can talk to me or any other board certified urologist, and that's great. But when you go over this patient satisfaction rate and sexual partner satisfaction rate, I can quote you the data, 98 and 96%. I just did. But it's very helpful to speak to a man and a woman who have been down the road, have exhausted these other things, the anxiety, the depression, and they went through the surgery to have a penile prosthesis. And it's great that Coloplast offers these spectacular men and their sexual partners who can talk to you by phone. If it's something local, they might be willing to meet you for a cup of coffee. Pre-COVID, we did a lot of seminars live where they would get up in front of an audience. Hopefully we can get back to that. But these webinars work very well because we hit a larger target audience. But there are people like Bob Pendry that you can reach out to and just hear what he has to say, what his wife has to say. And so I think that probably speaks better than just hearing it from me, but to actually speak to someone who's been through the process and let them speak to you honestly about how the before, the days and weeks before surgery, the actual surgery, and the recovery time, and let them tell you how everything went. A lot of questions we get other than what we've been through so far. The cost of the procedure, we touched on that a few seconds ago. Will this affect the size of my penis? Listen, guys, you're not 20 years old. If you're 20, we wouldn't be having this discussion. And just like if you're not going to the weight room and hitting those biceps, even if you do, we just can't maintain the same strength and form and muscle that we did when we were young. So you're going to lose some length and girth with your penis naturally. So we have to work with what you have. So for me, when gentlemen come in with erectile dysfunction, wherever you are on the line of different treatment options, I'm going to move you along quickly. I'm not going to give you a treatment option and say come back in 6 months, because that may be too long. So for me, or any other board certified urologist who does a high volume of penile implantation, one way that they're a really good surgeon, they really care about men's health, is that they're getting you back in the office quickly, because if you need a penile implant, we don't want you to lose any more length, right? Does it affect your orgasms? No. The nerves to the penis work just the same. Just think about Viagra, Cialis, or the vacuum device. They're all a different way of giving you an erection. The penile implant is no different. It's just a way to get an erection. We don't affect the nerves. We don't make your orgasms quicker, shorter, more robust. We don't change it whatsoever. But we get that question a lot, and that's a really good question. Will anybody notice you have the implant? I told you, no one's going to know it unless someone reaches across and can feel something a little bit different, but you really can't tell. It looks completely normal. If they grab your scrotum and feel the bulb, yeah, they can tell. The recovery period, typically in my hands, the way I do it is I make an incision above the penis called an infrapubic approach. You can go above or below. I find that going above the penis with the infrapubic approach is a much less painful procedure. I'd say that probably 85% of my patients are engaging with inflating the penile prosthesis and actually having sexual interplay at 2 weeks using the infrapubic. But there is going to be about a week or two of some swelling, a little bit of bruising, just like you'd expect with any operation you have anywhere on your body. Again, it asks when you can use the device. With me, typically 2 weeks. If you make the incision below the base of the penis, sometimes it can take 6 to 8 weeks, because that incision is lying right on top of the bulb that you want to inflate, and it may be too tender. But that approach is still an acceptable approach. Do penile implants interfere with equipment like an MRI or going through the airport security? I haven't gotten that question many times, but a couple months ago, I think I did. And the answer is no. Nobody's going to know you have a penile prosthesis. You're not going to set off alarms going to the grocery store or the airport or anything like that. Does it affect the sensation of the penis, like the skin? No, there's nothing like that. That's the beauty of the implant. So, not all urologists specialize in andrology. They're not, experts in male sexual health, in pelvic medicine, and erectile dysfunction, although probably all urologists kind of dabble in it. I would encourage you to really, word of mouth, get online, Google, look at websites, find somebody who's a high volume implanter, because we know with studies that have come out not too long ago that urologists that do more than 25 implants a year, and that's still kind of a low number, but we know that their infection rate is lower and their redo rate is lower. In fact, guys who do about, guys and girls that do penile implants that do less than 10 a year, we know that their complication rate or their take back or redo is 30-35%. And those that do more than 20 to 25 a year, that number goes down drastically, closer to 3%. So do your due diligence, take your time. I know you want to get on this, but be very patient and make sure that you seek out a person you're very comfortable with, that you can have a good relationship with, but you feel like they're a high volume implanter. If you have any other questions, there's a cotoplasmenshealth.com web address you can go to. La Bombita is a great access for our Latino and Hispanic community. It's wonderful. I actually have some of that on my personal website, rclaywilliamsdo.com, which is listed here too. The La Bombita is on there for you guys. If you have any questions whatsoever, please reach out to that website. You can also contact the hospital that I'm employed with, the University of Texas Health East Texas Medical Center. So I hope I've answered all your questions. If you have anything else that we haven't addressed here, please make an appointment to see me. Please make an appointment to see your urologist, and hopefully get back to having more durable erections using one of the techniques we've mentioned. And again, if you've tried and failed some of these and it's just not working to your benefit, do not be shy or embarrassed or be scared about the penile implant. I guess that's my final take home is, don't be ashamed or scared about having a penile prosthetic implant. I can't say that every surgeon in the world, from every surgeon, whether it's orthopedic or cardiovascular or whatever it is not without its risk. But this is a very simple, novel, beautiful procedure that's been around for decades. It's not something that just hit the market. And so don't frown upon this, because this may be the answer that you've been looking for. So I thank you for attending. Please reach out if you have any other questions. And I look forward to seeing you in my office as soon as you need to talk about this wonderful option for you. So I thank you for attending, and I hope you have a good evening.